Good evening. My name is Jiza. I am one of the registered nurses on duty today. For my confirmation, can you please tell me your name and age?
Hi, Jisa. My name is Steve and I'm 34 years old.
Okay, how may I address you?
You can call me Steve.
Okay, Mr. Steve. You look so anxious. If you don't mind, tell me what bothers you.
Well, actually, I'm in the hospital after a road accident and I'm not
Mm.
seriously injured, but I have been told that I have lost much blood and I need a blood transfusion. But I have no idea about the procedure that is involved and I'm really anxious about that. I also heard from my
Yes,
friends that there is a great chance of getting infection through blood transfusion.
yes, Mr. Steve. Yes, Mr. Steve. I knew that you are a patient who had just undergone an accident, and you are in really need of immediate blood transfusion. But there is nothing to worry about that. It's a safe procedure, and in this situation, it is very essential for you that you might have some other news is related to some infections that which you may get from your that kind of information you may get from your friends, but actually there are no such complication for this blood transfusion, because before transfusing your blood, we are completely checking the donor's blood, and if there is any suspicions of any kind of infections, we won't use that blood, and we will cross match your blood with the donor's blood. So I think there is no chance of getting infection through this procedure. So you
Mhm.
don't worry about that.
Well,
And
actually,
uh,
I'm heard from a couple of my friends that HIV can be transmitted through blood transfusion. So
yeah, there are.
I'm really worried. Like, can I avoid blood transfusion?
No, no, Mr. Steve, you please try to understand us. In this situation, it is not possible to avoid blood transfusion. There are some cases, some persons who are affected with HIV after this kind of procedures, but there are oftenly. But in our hospital, we are following a very sterile techniques, like we are using new syringes, and there will be new equipments for you, and there will be nurses for close watching you, and there won't be any kind of such infections or acquired infections, so you can trust us.
Mm.
Any other concern regarding this blood transfusion?
Well, this is the first surgery or a procedure that I'm undergoing, so I'm really panicked about it. So, how long does the procedure take place?
Yes, I can sense your feeling that it may be panic for you that you are the first time attending such a kind of procedure. It will take around 30 minutes, and you will be fine after this procedure. If you're not agreeing to continue with this procedure, it may leads to hypovolemic shock and some dangerous situations. So
Hmm.
um, I request you to please cooperate with us.
Okay. Would
Uh,
I be able to get discharged right after the surgery, or do I need to stay here?
no, there is no need to stay here. We will check your condition. The doctor will check you, and then he is the authorized person to give you discharge. So actually, it's a question that is beyond my scope to tell.
Okay.
But definitely, you need not to stay all night.
Okay, I understand that. All right.
Mhm. Okay. Okay, Mr. Steve, if you have any other concerns regarding this, you can openly ask me. I think you are clear with all the doubts.
Yeah, I'm happy to undergo the procedure. Thank you.
Okay, Mr. Steve. Okay, thank you. Good evening. My name is Jiza. I am one of the registered nurses on duty today. For my confirmation, can you please tell me your name and age?
Hi, Jisa. My name is Steve and I'm 34 years old.
Okay, how may I address you?
You can call me Steve.
Okay, Mr. Steve. You look so anxious. If you don't mind, tell me what bothers you.
Well, that's a good one. So you have done a good job. So the way you have asked is much better, okay? So that's how you need to do it. I'm happy with the way that you have asked me about my concerns, okay? Good. Keep it up.
Okay.
Well, actually, I'm in the hospital after a road accident, and I'm not seriously injured, but I have been told that I have lost much blood, and I need a blood transfusion. But I have no idea about the procedure that is involved, and I'm really anxious about that. I also heard from my
Yes,
friends that there is a great chance of getting infection through blood transfusion.
yes, Mr. Steve. Yes, Mr. Steve, I knew that you are a patient who had just undergone an accident.
Okay, you said you. I understand that you are a patient who has undergone an accident. That's wrong.
Mm.
Don't say that you are a patient who has undergone an accident. No, you have to say that you have undergone an accident. I have understood that you have undergone an. I mean, you have met with a road accident. You don't need to say you have undergone something. Okay, undergone is
Mm.
actually used only for the procedures. Okay, only for the operations.
Procedures.
Yeah, only for those kinds of things you can use. You need to undergo, yeah, an operation, you need to undergo a surgery, you need to undergo blood transfusion, you need to undergo something, and blah blah blah. Okay, you
Mm.
can't use it, for the road accident. So you can say,
So that,
yeah, sorry.
uh, actually, I meant to say you had an accident, but it accidentally came as
Yeah, that's not correct.
undergone.
Okay. That's not correct. All right,
Mm.
let's go further. Okay.
And you are Okay, in
Okay.
a really need of immediate blood transfusion. An accident, and you are in really need of immediate blood transfusion. But there is nothing to worry about that. It's a safe procedure, and in this situation, it is very essential for you that you might have some other.
Try not to give kind of background noises like and so on. Okay, so those background noises need to be avoided, like you need to keep them to the minimal. Okay, so try to avoid these background noises when you talk to.
Okay.
Okay, or try to minimize them. Let me make it like, if you can't make it zero, it's okay, because even the native speakers do commit some kinds of background noises. That's fine, but don't just give too many background noises. Okay, don't give background noises very frequently. It's not good.
Okay. News is related to some infections that
Newses, okay, you said newses, right? News
Mm.
is an uncountable noun, which means news can be used either as a plural noun or as a singular noun. So there is nothing to change. It doesn't mean that like news is a singular noun or newses is a plural noun. No, that's wrong. That's not the case. Okay,
Yes.
do you understand?
Okay.
Mm.
Yes, sir. Other news is related to some infections that which you may get from your that kind of.
You used that and which together. It's not good. You need to use either. That you may hear from your friends or colleagues or so on. Don't say that which you may hear. That's wrong. I mean, that
Okay.
and which are the same thing. Okay, you have to use only one among them. You can't use
Okay,
them
sir.
together. For
Okay.
example, you can't say, I have to undergo an operation that which will be scheduled tomorrow. That's wrong. Okay, you have to
Okay,
say,
sir.
I have an operation that is scheduled for tomorrow. Okay, I have an
Okay.
operation which is scheduled for tomorrow. Okay, either is okay, but don't use them together. That's wrong.
Oh,
That's what you have
okay,
done
sir.
here. It's not good.
Okay. Of information you may get from your friends, but actually there are no such complication for this blood transfusion because.
There are no such complication. Okay, remember that whenever you use the verbs, okay, you need to be very careful with the nouns after them. So if you use there are no such complication, that's wrong, because there are refers to the plural noun. Are is a plural noun. If you want to use a plural noun after that, you need to use them. Okay. Otherwise, if you would like to use a singular noun, you have to use there is no complication. Okay. Otherwise, you have to say there are no such complications.
Okay. Nope.
It must be a plural noun.
Okay.
There is no complication. That's good. Otherwise, there are no complications. So use, the verbs and nouns appropriately. I mean, a singular noun can go only with a singular verb. A plural noun can go only with a plural verb. You can't mix them up. It's not good.
Okay.
Do you understand what I mean?
Okay, sir. Yes, sir. Yes, sir.
Good.
Before transfusing your blood, we are completely checking the donor's blood, and if there is any suspicions of any kind.
Okay, if there is any suspect or suspicion. Okay, there is no suspicion. It's actually suspicion.
Suspicion.
Yeah, it is suspicious, isn't it? That's what we use.
Yes.
Okay, so I'm suspecting, or suspicious or suspicion. There is no suspicion. That's one thing. And the other thing is, whenever you need to explain a procedure, okay, which involves a number of steps, you have to use connecting phrases. You have to say, well, the blood transfusion involves a number of steps. Firstly, blah blah blah, then blah blah blah, after that blah blah blah, finally blah blah blah. So this is the way to explain it to a common man. Okay, I would be able to understand very well when you explain it using connecting phrases, step by step manner, in a step by step manner.
Okay.
Do you understand? So the way you have used the connecting phrases was very, very poor. It was not up to the mark at all. No, it's not good. See, connectivity is one of the assessment factors, okay, which means you need to gather the information and provide the information in an effective way. So how are you providing me the information? It's not up to the mark. The way you provided the information isn't good. No.
Okay, sir.
You have to say, like, there are a number of steps that are involved in this process or in this procedure, and then you have to say first, second, third, and so on, or firstly, and then following that, and then after that, and finally. So that's the best way to get the message across easily, isn't it?
Okay, sir.
All right, let's go to the next one.
Kind of infections, we won't use that blood, and we will cross match your blood with the donor's blood. So there is, I think there is no.
So there is, and I think there is. Okay, so don't give any false starts. What is a false start? You start a sentence, okay, with the phrase or a word, and then you go back to the beginning of the sentence and then start telling the same word or using a different word, okay, once again from the beginning. It's not good. So when you say so there are, or so I think there are, like, so they are the same thing, isn't it? Use only one.
Okay, so and I think.
Okay. Yeah, you mentioned the same thing, like, so there are, and then I think there are no. I mean, it's the same thing. Like you have told the same thing.
Okay, sir.
I'll make it clear once again. I'll play this. Okay, just give me 1 moment.
Blood, and if there is any suspicions of any kind of infections, we won't use that blood, and we will cross match your blood with the donor's blood. So there is, I think there is no.
So there is, I think there is, isn't it?
Yes,
there is incomplete, and I think there is again incomplete. So you have given the false starts in this case. It's not good. You have to use, so there is no infection. That's it. Finish it. Don't just come back and then start with the different words and then. So I think there is no. It's not good.
Okay,
you understand what I mean? You can make notes on your notebook if you have.
Chance of getting infection through this procedure, so you don't worry about that.
Procedure, so you have included the final word of the previous sentence and then the first word of the next sentence together. I mean, okay, like there is no much chance of infection, so this procedure is good. No, this is not correct, because the final sentence, the last sentence ended with the procedure, okay, and the new sentence started with the so, which means There must be a pause between two sentences. After every full stop and a comma, you need to give a pause. You can't just keep on speaking. That's not good. Yeah.
Okay, sir.
Let's go to the next one. Well,
And
actually, I'm heard from a couple of my friends that HIV can be transmitted through blood transfusion. So
yeah, there are.
I'm really worried. Like, can I avoid blood transfusion?
No, no, Mr. Steve, you please try to understand us.
Okay, one thing you need to do is that whenever the patient shares the concerns with you, you need to let them share with you. Do not interrupt in between. Okay, one thing I have
Okay.
also noticed in
Okay.
your conversation is that you have been talking, always without giving the other party to share their opinions or concerns. Do you know what I mean? You also need to, whenever
Yes.
you describe a procedure, you need to get the patient and understand those information, and then you have to ask them the questions. Did you understand this? Do you have any questions? Are there any doubts in regards to this procedure and things like that? You have to ask, you have to get the confirmation from them that they have understood the procedure before you move on to the
Okay.
next question or next bullet point,
Okay.
I would say.
Okay, sir.
Okay, but you didn't do
Okay.
that. You have been talking, always, like, continuously and consistently. It doesn't mean, see, the role play conversation is not a one way conversation. It is a two-way conversation. I mean, it's not a monologue. It is actually a dialogue. Dialogue means
Okay, sir.
there are two people who are going to share their opinions, okay, with each other. All right, it shouldn't be a
Okay.
one way communication. Okay.
Mm. Yes, sir. In this situation, it is not possible to avoid blood transfusion. There are some cases, some persons who are affected with HIV after this kind of procedure.
Who are affected? There are
Who are
some persons who affected after this procedure. No, there are some persons who are affected after this procedure.
procedures,
Okay.
but there are oftenly.
There are oftenly. There is no word in English called oftenly. No, there is no
Often.
word at all. It's only often or frequently.
Often.
I think you have
Okay.
confused between these two things. One is
Mm.
often and the other is frequently. So you have to use either often or frequently. Don't mix them up together and then create a new word yourself. Don't do that,
Mhm.
please.
Okay.
Okay? Right, let's go to the next one.
Okay, sir. But in our hospital, we are following a very sterile techniques.
Okay. A very sterile techniques. Okay. A is an article for a singular noun and you have used it with the plural noun techniques. Does that make sense? No. You can't say he is a boys. Can we say so? No.
No.
She is a girls. Can we say so? No.
No.
That's wrong. So we are following a very sterile conditions or
Follow.
techniques. That's wrong. We are following sterile
Following
techniques.
sterile conditions.
Otherwise, we
Okay.
can say we are following a safe procedure. That's it, or a safe method or safe technique. That's okay.
Okay.
Okay, and then you can provide the next information. Anyway, let's go to the next one.
Like we are using new syringes, and there will be new equipments for you.
Okay, equipments. Okay, that is again an incorrect phrase. There is no plural noun or a singular noun for equipments. Okay, equipment itself is an
Equipment.
uncountable noun, similar
Okay.
to information or staff. You can't use staffs or staff. I mean, they are the same thing. Okay, you can use it as you wish. All right. So don't say
Oh,
equipments. Okay,
equipments.
equipments is not a plural noun. There is no word like equipments. Equipment itself is a plural noun. Equipment itself is a singular noun. For the uncountable
Okay.
nouns, you can use them as you wish. Okay, you don't need to change the form of the noun. Do you know what I mean? It's only
Okay,
one
man.
word that can represent both the singular noun and the plural noun. It's the same thing as
Okay.
information. I have got information. Okay, I have got
Mm,
informations is incorrect. All right,
I've
let's go
got
to the next one.
information. And there will be nurses for close watching you, and there won't be any kind of such infections or.
There won't be any kind of such infections. I think you used plural noun. When you say any kind of infections, that's wrong. You have to use any
Oh,
kinds of infections. Okay, kinds always goes with the plural noun.
okay.
Kind always goes with the singular noun.
Mm, okay.
Okay.
Mm. Acquired infections. So you can trust us.
Mm.
Any other concern?
Never ever create any sentences or questions that are grammatically incomplete. Please. Don't ask me any other questions or concerns do you have? No, that's wrong. You have to say, do you have any other questions? Do you have any other concerns? Do you have any other doubts? Do you have blah, blah, blah? Don't say
Mm,
any other questions, any other concerns. That's wrong. It is, although it is a semi-formal conversation, you must produce the sentences that are grammatically 100% correct. They must be 100%
mm,
grammatically accurate. You can't produce butler English in your conversation. Do you understand what I mean? It must be
got.
100% correct from the grammatical perspective. Okay.
Okay.
All right. Let's go to the
Okay,
next
sir.
one.
Regarding this blood transfusion.
Well, this is the first surgery or a procedure that I'm undergoing, so I'm really panicked about it. So, how long does the procedure take place?
Yes, I can sense your feeling that it may be panic for you that you are the first time attending such a kind of procedure.
Don't provide like okay,
Mm,
those kinds of
mm.
background noises.
Okay, sir. It will take around 30 minutes and you will be fine after this procedure. If you're not agreeing to continue with this procedure, it may leads to hypovolemic shock.
Okay, it may leads to, okay, after every auxiliary verb, okay, if I use, for example, can, could, may, might, would, and so on, I need to use the present verb only, which is in the verb form, not in the verb plus s form. Okay, I mean, you have said it may leads to. No, it may lead to. All right.
Okay,
If you want to use verb plus s, I'm very happy. You use it without any auxiliary verb. I mean, it leads to. That's good.
okay,
I'm happy with that.
okay,
So use either it may lead to or it leads to. Got it?
okay,
Cool.
okay, sir. I got
Let's go to the next one.
some dangerous situations. So
Hmm.
um, I request you to please cooperate with us.
Okay.
Uh,
Cooperate. Okay. The way you have pronounced the words wasn't up to the mark. It's cooperate. I would like to request you to
co-
cooperate with this. So, but you said cooperate with this. It's cooperate.
cooperate with.
Okay. There must be a pass in between, or there must be a gap in between. Okay. Cooperate. Cooperate. Okay.
Mm,
So don't say
okay, sir.
cooperate with us. Okay, that's wrong. Cooperate is wrong. Cooperate. Please cooperate with us. Okay, cooperate with us. Would I be able to
Okay.
get discharged right after the surgery, or do I need to stay here?
No, there is no need to stay here. We will check your condition. The doctor will check you.
Okay, we will check your condition. Okay, the doctor will check you. Okay, the doctor will check you. No, that doesn't make sense. The doctor will check your health status, or the doctor will check
We
your
will.
health condition. Otherwise, we will check your health condition. Would be all right. Okay.
Okay. And then he's the authorized person to give you discharge. So actually, it's a question that is uh, beyond.
Beyond my scope of knowledge, or beyond my scope, or beyond my
Okay.
knowledge. Okay, don't give long pauses here, it's not good.
Okay. So my scope to
Okay.
tell.
Okay.
But definitely you need not to stay all night.
Okay. That's a good sentence, I'm happy with it. Understand that. All right.
Mhm. Okay. Okay, Mr. Steve, if you have any other concerns regarding this, you can openly ask me. I think you are clear with all the doubts.
Yeah, I'm happy to undergo the procedure. Thank you.
Okay, Mr. Steve. Okay, thank you.
All right, everything else is good. Okay, I just would like to give you some comments on the way you have organized the role play conversation. Okay, the
Okay,
first
sir.
and foremost thing is that you need to understand that you are the leader for this conversation. You are not the participant. Do you understand what I mean? There are two things. One is
Yes.
the leader and the other is the participant. The interlocutor or the patient is the participant, but the healthcare professional, in your case, it is a nurse, right? You are a nurse, isn't it? So you need to take the leadership role. You need to, take control of the whole conversation, okay? And you need to
Okay.
summarize the whole conversation in the end before you conclude. You need to
Okay.
ask me questions to see whether I have understood all the information, okay? Whenever
Okay.
you complete one bullet point, you need to ask a question in regards to that to see whether I have any questions for that bullet point or not. And even before you start each bullet point, you need to tell me what you are going to do. For example, the first bullet point, let us go through the first bullet point. The first bullet point in your case is find out about the patient's concerns. Okay, so you need to say, okay, before we discuss further, I would like to know what are your concerns. Okay, you need to ask me what are the
Okay.
actual concerns that you have, or what are your actual concerns. Okay, that's the first thing. And whenever I have shared with you, the what you can say, the problems and are my concerns, you have to tell them, you have to give me the reassurance. You can give me the reassurance in terms of statistics. You can't just reassure me, no, you will be all right, no, you will be okay, we have good procedures, blah blah blah. No, it's not the case. You need to have solid evidence in order to reassure me. Okay, so what kinds of evidence you can provide? You can say that in the past 5 years we have performed more than 5,000 blood transfusions and no patient has
Okay.
received infections yet. So we all the operations were 100% successful and the patients have recovered from blood transfusions within 2 weeks itself, because we have got the highest quality standards and the safest screening procedures that are in place. On top of that, we also have the highly qualified medical professionals who are well versed with these kinds of procedures. So you can provide all these things, and you have to conclude it by saying, as a result, you are in the safe hands. Okay, so you need to provide these kinds of evidences in order to make me calm down. You can't just simply say, no, we have got the procedures and you should be all right, we are following the sterile conditions, blah blah blah. No, you can use some statistical evidences. Okay, they don't need to be true. You can use them. That's
Okay,
fine.
sir.
And then when before you start explaining the procedure for the blood transfusion, now you have to tell me, you have to share with me this. Okay, then okay, now I'm gonna provide you the information about the blood transfusion and how it's going to take place. Is that
Okay.
okay with you? So ask me the consent. Like, don't just keep on speaking. Okay, you need to ask me the consent. You need to encourage my participation in the conversation, right? You are the leader, but it's not the monologue. You are not going to only talk. You need to encourage the patients to take part in the whole conversation. You need to
Okay.
say, are you happy with it, or is that okay with you, is that clear with you? So you use these kinds of questions quite often. Okay, whenever you, for example, whenever you describe a procedure, you need to ask this. Whenever you want to proceed with the something, like for example describing the procedure, it's good to ask them, are they happy with it? Or then you go through the, well, this one, for example, you can say, well, this procedure involves a number of steps. Firstly, we do this, then we do this, and then we do this, and finally we do this. Okay, that's how you need to tell. Okay, and then you have to, when I you have to stress the patient that really needs the blood transfusion in order to recover fully. You have to tell them, I didn't you have to tell them, like, these are the problems that you may have in the future. and as a result you have lost the blood. If you go, you will have these kinds of things and stuff like that. That's how you need to say. And then you have to summarize. Before you conclude, you have to summarize everything, and then you have to again ask me if I have any questions and so on. Okay, even before the conversation starts, you have to summarize. Okay, you have done the introduction part very well. That's good. The way you have handled the bullet points could have been much better. Okay, it's not that good. All right. Okay, to me, all right, to me, see, I'm really strict. Okay, I'll give you the honest opinion. To me, this one sounds like a C plus graded answer. You will be able to get 300 out of 500. Okay. The problem is that you have been talking a lot. It's not the good thing. Okay.
Okay.
Are you happy with the way I have assessed your skills?
Yes. First time I get such an assessment.
So connectivity could have been much better. Vocabulary could have been better as well. The grammar is one of the worst areas that needs to focus. All right. And then the way you have organized the conversation is not good at all. You have to organize everything. You have to summarize it. You need to take the leadership role. It seems to me that you have been taking the leadership role, but you're not encouraging the patient to participate, to acknowledge, to share the concerns. Okay, whenever I share the concerns, you have to go through that, and you have to show sympathy, towards the patient. You have to say, I'm really sorry to hear that. You need to use those kinds of things. But you didn't use, I think, you mentioned like, I can sense. It's okay, you can sense, that's fine, but you have to say, I'm really sorry to hear that. Oh, I understand, how panicked you are. Use these kinds of words and phrases. They are going to help a lot. Okay.
Okay, sir.
All right, no worries. Yeah, that's the one. And you can let me know if you're happy with my assessment, and then we'll go from there.
Okay, sir. Sir, can I improve within this short time?
Of course, you can. Why not? Because your basic communication skills in speaking are good enough. You have already scored C plus grade. Okay, so I'm pretty confident that you can make it to B grade easily. You need to know the techniques, and you need to practice. Okay, so for the next 1 week, okay, what I'm going to do is I'm going to assess your speaking skills every day. We'll have one speaking role play card every day. Okay, I will teach you, the techniques in the next session. Okay, I'll teach you the techniques for your speaking section, and then we will have a role play card. And if you wish, what I can do is that I can add you to my WhatsApp group as well, where you can find out lots of nursing professionals who are going to appear in the exam sooner or later. All right, and you can talk to them on a regular basis as well. I'm happy to do that. Do you understand?
Okay, sir.
And I also have the sessions on a regular basis, so you can also join there as well. Plus, I'll also provide you additional sessions. Okay.
Okay, sir.
I try to help you out as much as I can.
Okay, sir. Thank you. So tomorrow we will have class.
Yes, definitely. Yeah, definitely. Yeah. So if you are happy with my assessment, then
yes,
we can
sir.
go ahead.
I'm really happy.
Yeah, it's good. I mean, look,
I
your
like the
speaking is not
way
that
you are.
bad. Yeah.
Sir, I like the way you are correcting our mistakes. I liked it. I'm really interested, and I also watch your YouTube channel, YouTube last one which you sent.
Yep.
So I have some problems with this, like grammatic mistakes. I have a lot of since I was studied in a Malayalam medium, and I don't have a grammatic base.
Yep.
But I'm trying.
But it's not that bad. Your grammar isn't that bad, but there are minor mistakes. Do you know what I mean? They are mostly inappropriate use of nouns and verbs, prepositions, articles and things like that. So you have to focus on them. But I'm happy to go through that. There are a few things that you have to improve, but I think you should be all right, I believe.
Okay, sir. Anyway, I'm ready to work hard.
Yeah, you should be all right.